I'm heading the German part of the International MAJIC consortium, which is headed by Jamie Ferrara and John Levine in the US, and US centers and German centers and centers from Italy and Bangkok and Australia now prospectively collect serum samples to identify and verify, validate serum biomarkers of graft-versus-host disease. And we have made a lot of progress. We are now in the phase of performing risk-adapted clinical trials. The hypothesis is if we detect GvHD, severe GvHD, very early by an increase in biomarkers, we can interfere more specifically in these patients and can avoid overtreatment in the patients who don't have high biomarkers. And now the first clinical trials are under way. One trial on natalizumab in the US has just recently been closed. We in Germany are currently performing under the guidance of Francis Ayuk from Hamburg, a first-line treatment of graft-versus-host disease, acute graft-versus-host disease with ECP and steroids if patients have high biomarkers at the time of onset of GvHD. This study is currently running. We have the German biomarker lab, and we have shown that it's feasible to get biomarker results within 24 hours, which is a prerequisite for doing biomarker-adapted clinical trials. Now, of course, there are still false negative results of biomarkers. They are quite sensitive, but there are still patients who are not detected and patients who are missed. So we tried also to optimize this biomarker prediction. There are several approaches. You could integrate in the biomarker scores clinical parameters. This is planned in the US side. Our group is focusing on research in microbiota, and as I mentioned, we have shown that early loss of commensal bacteria is a predictor of poor outcome after transplantation. And so we collect within Germany not only serum biomarkers, but also stool samples and urine samples to assess microbiota parameters in these GvH patients. And the idea is to add some parameters arising from microbiota analysis to the serum biomarkers and to see whether the addition of microbiota markers increases the sensitivity and the predictive capacity of these biomarkers. We cannot tell in the moment whether this will happen, but we can tell in the moment that we found very close interaction of systemic biomarker release with microbiota damage, especially REC3 alpha, which is a marker of Paneth cell damage, is related to microbiota damage. And this makes sense as Paneth cells produce antimicrobial peptides. And there was an expected interaction, and we are currently working on this interaction in further details. So at the end, it could be that we will have biomarker-guided GvH treatment with specific immunosuppressants on one hand, and on the other hand, microbiota correction or microbiota-guided treatment, and both come together. This was fit in the concept of graft-versus-host disease as it was shown by Pavan Reddy. He said we do not only need immunological tolerance, but we also need tissue tolerance to get an optimal result and to rescue patients from graft-versus-host disease. And I think microbiota is an important part of this tissue tolerance.